Okay, so I'm here with my patient Mohammed. Mohammed is 11 days now after surgery, and you may remember him from a prior video where we documented his surgery day. But I wanted to ask Mohammed, how's the process been as far as the recovery? How's the pain? How's getting back to normal life?
It's great. I mean, didn't feel any pain at all. The process was really good.
It looks like you've been taking good care of it, and I'm gonna show everyone, but all the scabs have now fallen off. He's back to normal life. Obviously, the haircut that we gave him is not the best haircut in the world, but now that hair that we shaved is now growing back, and he's probably gonna buzz down the rest of the hair to make it match a little bit better. But did you have any swelling?
No.
No swelling? Yeah.
No bleeding.
Some people get a little swelling, some people get moderate amount of swelling. We're very aggressive. We move a lot of hair, so but in his case, he had no swelling, no pain. People have been looking at it. I'm going to show the incision, but let me just kind of show the top here. So now you can see where his hairline's going to be, and you can see that it's going to reframe his face. His new profile is going to be much, much better. And I'm kind of going to zoom in here. You can see that actually there's hair in the grafts that we placed, but don't count on that hair sticking around. A lot of times the hair will fall out. You can see how it comes into the side here. I'm going to show you the crown. So the crown, again, the scabs are all off. And you can see the whorl pattern that we created. That's going to be a really natural looking crown for him. Now remember, the top is bare now because he allowed us to shave. The reason for shaving the head, again, is not only for us, but it's really for the patient, because when he's trying to wash all the grafts, sometimes that hair gets in the way. So we were able to, he allowed us to shave, which really makes things clean, makes it very easy. I'm going to show the back incision now. So he's here for his suture removal. So the sutures are going to come out today, but I want to show you that it's very difficult to find his incision, almost impossible to see where his incision was. I'll tell you that it's up here. I'll show you in a second. So let me show the suture line. Everyone worries about suture lines. Oh my gosh, I've seen these popsicle sticks, scars in his magazine. So this is with the sutures, the stitches are still in. So you can see it's basically going to be as if someone took a pen and drew a line. So I'm going to show this again once the sutures are out, but I just wanted to show you. That's completely hidden, number one. I mean, you're not going to be able to find the suture line. I don't know if the camera picks that up the right way, but there's that little red line you can see. Okay, Dr. Huebner here with Mohammed. We're just finishing up taking out his sutures here. And, sutures take about 5 minutes to take out. It's no big deal. But you can see his scar. Still has some crust on here that are going to fall off, but it's like that thin. That little line right there. Comes around here. That little line. Now that line's even red, it's going to fade to match the scalp. So you're not, in about a month or two, you're not even going to be able to find that. So that is the line. It's as if you took a pen and drew a line. I always say that, but you can actually see it. If I took a pen and drew a line, it would be about that big. So people get very misled by proponents of FUE and think that you're going to have this horrible, horrible scar in the back of your head, and it's simply not true. Simply not true. So a lot of people then go with FUE, and they'll sit there all day, 8 hours, 10 hours. Somebody's taking out the hairs one by one in tiny, tiny follicular units, and they're getting smaller grafts. They're not getting as efficient grafts either, because they're transecting grafts. It's impossible not to transect. The transection rate's much higher with FUE as opposed to the strip method. So I can tell people all day long, but it's videos like this that allow us to show you. The proof's in the pudding. That's what I say. The proof is in the pudding. And I encourage anyone, I was telling Muhammad, he has some people that are kind of skeptical, and maybe some family members even that are interested in getting this potentially. That's your scar. That's your scar. Right there. That little line. Completely going to be hidden by, I mean, he's got to have his hair almost shaved to find that. And right now, and this is immediately after taking the sutures out. These little red areas right here, little dots on either side of this, are where the suture was. So these are all going to fade. The redness is because the body tries to reject a suture. The body will try to reject anything that's foreign. So the suture is a foreign body, just like any other foreign body. So you have this inflammatory response around the suture line, so it's red. But that redness, once the suture's out, now this redness will go away. Just like if you had a splinter in your finger, you take the splinter out, a couple days later, it's not as red, right? So it's the same idea. So if he comes back, maybe we'll see him. I encourage all our patients to come by and say hello. We love to see how our patients are doing. But I guarantee you, if he gave his friends, anybody, in a month or two, if he gave them a comb and said, find where I had a hair transplant, find my suture line, I guarantee you no one's going to be able to find that. If they look closely, maybe after about 5 to 10 minutes, they could probably find a little tiny line that you would draw with a pen, but that's it. So this is, like I said, the proof's in the pudding. Don't take my word for it, take the proof of it. Suture lines. Suture lines 101. That should be the name of a course for prospective patients. Don't let people scare you away from the strip method. If you have a skilled doctor doing your transplant, you should have a scar like this.
What's the advantage of this strip, of what he got as versus the FUE?
So here, great question. So people say, well, why do you even have to do that? You could have a FUE, you don't have a scar. First of all, FUE is not a scarless procedure. You actually have more scar tissue in total than you would with a strip because you're getting tiny polka dots. The thing about FUE is they don't use just a little area like this. They use the entire width of the back of your head where your hair is. So then you have this swath of polka dot scars in the back and the side. So then if you ever need an additional procedure, let's say even 5 years from now, you're going to have all this scarred up tissue in the back. So in his case, if he needed more hair, which he may not, you have above it, you have below it, where you have a fresh area of tissue without any scar, that you could get an additional amount of hair for him, just as much or more than he got last time. He could go above it, and he could have a third procedure if he needed it. He probably won't need that much hair. He could have a third procedure to go below it. He could have another one goes above it. So you're not scarring up your entire donor. Your donor is your future. Your donor is everything. If you screw up your donor, there's not a lot you can do. So that's why it's very important. If someone that needs hair, needs some meaningful density, this is the way to go. Who cares if he has one of these undetectable scars or two of these undetectable scars on the back of his head? He now has the hair. So again, thank you, Muhammad, for allowing us to see how the process is, the healing process. I have to commend you for taking such good care of this. Muhammad was stuck to the directions. If you stick to the directions, you won't have any problems. He had no swelling. He was able to rest, slept upright for 3 days, rinsed his hair the following day, and then washed his hair daily. And you can see when he came in, he had 0 crusts on his head. He had 0 scabs. He had not 1 scab on his suture line in the back. So that's how you get back to normal. So he's now 11 days back after the surgery, and you can see he's back to normal life. He's been back to normal life for several days. So you don't need to take a huge amount of time off work. He's in a situation where he works from home. He can wear a hat. It's not a big deal. So you can see now his natural hair is gonna start growing again. You can buzz this down a little bit more to match. So then he has just a short haircut. The scar is not going to be an issue for him. So really important after the surgery to just follow the instructions. If you follow the instructions, you get back to normal life. It's not a problem. Thanks again, Muhammad. We look forward. The more exciting part is results. So in a couple months, we're going to show you what he got, and that's really exciting for us. So thanks again.